Happy Friday, everyone. We will go ahead and get started. And it is good to be with you. I didn't get to be with you for the last coffee chat session because I was doing self-care and taking vacation with my husband for our anniversary. And we were so lucky to catch COVID, I believe, on the plane. I'm going to blame the passenger next to me who was coughing and sneezing, so had an awesome breakthrough COVID infection that surprised me and put me out of work for a good week and a half after I took off a week for vacation. So good times. I needed another vacation after being stuck in the house with all of my kids for that long. But I did get a chance to look at your answers to the Kahoot question, and which I hope you thoroughly enjoyed Kahoot. By the way, there'll be more Kahoot today, so always just be ready with your Kahoot app. During these coffee chats, we'll ask a more serious question today, not too serious because it is Friday, and then another one that is of a little bit less serious nature. So when I read through your responses on what you do for self-care, mainly what I was thinking was, I could be friends with like everyone here, like watch TV, get my nails done, go on walks, read. I'm like, oh yeah, we just need to start some groups and do that. I don't know if any of you do group walks around your offices. I know the Rolla office that I visited, some of them did. We were lucky enough to have a greenway, a trail at the Department of Health building, and it was just swarming with people walking. So encourage to take your 15-minute break, go out and take a walk, get some sunlight, do some self-care, or take a break and read. Looking fabulous with someone's and their form of self-care, and that was an amazing answer. So very much enjoyed reading those. Also, so part of self-care that I didn't see on the answers was pets, and that kind of surprised me, but it's also not something that my mind immediately goes to with self-care, but I do enjoy my status as a crazy cat lady and the amount of kittens that run up to me and come to sit on my lap when I go outside and sit on my porch. So the problem was we didn't have that sort of self-care in the office, but now we do. So if you have not met her, this is the division's official mascot. This is Dee Dee, and she is a joy for all companion pet. I don't know if you can hear her purring. I turned off her meowing because she gets a little crazy. But yeah, since they don't allow animals in the office, I love those joy for all companion pets, and they really are great for social isolation and for therapy when you're a little bit stressed out at work, which never happens, right? So one of the things that, okay, so I have a list of things I wanted to update you on, and 30 minutes always goes by so quick. So I want to give you some time to prepare for the Kahoot question. So pull up your app if you haven't already, and Heike is going to share her screen, and I am very interested in hearing your perspective on this. So I want to give you a little extra time with the question while you're getting in. So if the question is, if you were division director next week, what's the one thing that you would do in that role to make your job better, the division better? What would you do if you were in this, if you were sitting with Dee Dee next week and hanging out with her? Would love your feedback on that. So 3, 2, 1, and give everybody some time to type their answers. Drink some coffee. Okay, looks like we're going to see some answers now. Give everyone the day off. Oh, I would love to do that. Hours more flexible, simplify things, eliminate duplicate work, on the job and the field job shadowing that would count towards promotional opportunities. Oh, there's some really good ones in here. Increase the pay for our direct care staff, advocate. Oh, a thank you letter to all families. So if you haven't noticed, I might be doing this for selfish reasons. I'm looking to grab your great ideas and find a way to implement them. And there'll be a little bit more about how we can do that in a more structured way towards the end of the call. So thank you for those of you who submitted an answer, and if you think of one later and just want to shoot it to the DD mail, that would be great. You can always tell me how I could do my job better or anything that we can do better as a division at any time. The feedback is extremely appreciated. And so I wanted to give a couple updates. Okay, so let's try to get through some stuff that I think is just like going on in our world right now, and I want to make sure that we can all be on the same page and you feel like there's transparency in what's going on and here in central office and in administration and what you're experiencing. So the first thing is vaccine boosters. It came out in the news, those are, the Pfizer booster is approved for individuals with a condition that puts them at risk, which is our population, those over 65 and frontline healthcare workers. And they are eligible immediately, and you have to be 6 months post full vaccination in order to go ahead and get that. And then what we expect in the next 2 to 4 weeks is the Moderna and the Johnson & Johnson boosters to be approved. So if you're someone who had Moderna or Johnson & Johnson, then we expect those to come through. So as we get more information on that, how to access it, questions that may come up from clients and families, we will send that out so that you guys and your teams have all of the information that you need to help people make decisions, help them understand where to go, and really appreciate your partnership in that. The other thing with vaccines right now is, unless you've been hanging out under a rock or doing like a media cleanse of some sort, you might have heard about vaccine requirements, maybe. So here's how I like to frame this conversation, because we'll probably all get questions, right, from stakeholders, providers, families. People are, in general, just anytime you say the word mandate, requirement, there's just a lot of anxiety around this. And we know that. So here's what we do know, here's what we don't know, here's kind of when we'll find out more information. We are 99.9% certain ICF staff it will be a requirement for them to receive the vaccination. What that actually looks like and how that's written up, and whether there will be a testing sort of, test out sort of option, we don't know. The HCBS providers in general, I'd say it's about 50-50 on whether they're included in the vaccine requirement. In the announcement, HHS said it was for Medicaid-funded healthcare providers, including home health. About 50% of the, I say 50-50 because about 50% of the time when CMS or HHS announces something and they use the word home health, they really mean just home health and hospice. And the other 50% of the time, they mean home health, including home and community-based services. So we won't know anything on that until the rule that is issued by CMS in, we believe that is coming in October from everything that we've heard. So as we get more information on that, hopefully that helps you answer questions that you're getting from providers. Really, HHS did not clarify whether HCBS would be included in the healthcare provider definition. And so we won't really know whether they consider that to be a required entity until the rule comes out and we know the language in that rule and that we'll be communicating that information. As far as the organizations with employees, 100 or more employees, I imagine that we will all sit back together and watch the lawsuits play out and then find out what's going to happen. Prediction. I made a really accurate prediction earlier this week. I don't know. No, Julie Peterson's taken the day off. And I told her that I was going to start charging fees for my clairvoyant services. So a lot of CMS news. Appendix K, Station MD, approved. So it can be in the waivers now. And we thought we had written this really great memo about how it was going to be a seamless process for clients to get Station MD. And we wrote that for support coordinators and TCM agencies. And then when we had a review done on the memo by a couple folks who do support coordination, they were like, this doesn't make any sense, and this is not going to be seamless. And so our memo to provide perfect clarity, always good to get feedback from people who actually do the work, was ultra confusing. Good to know. We are rewriting that, but it's also much easier to just convey through conversation. So here's how Station MD will work. And it won't work like any other service that we authorize because it's different. It's special. So for clients who currently have Station MD and they're accessing it, it's going to be like a flip of a switch behind the scenes. So basically, they're billing on contract right now because it wasn't in a waiver. It was contracted with COVID relief funds, and now it'll be Medicaid funding. So those will be switched over to waiver authorizations behind the scenes, and then we will just work on communication on when the billing needs to flip on those. with clients who aren't currently accessing Station MD, and either the caregiver, the client, the family needs to call Station MD and use it for any reason, to turn on the waiver authorization, they just call Station MD. As soon as they need them, the day, hour, minute they need them. It's not something you can plan for. It's something that, you know, as you get sick or you have a medical question come up, then you want to be able to access that service right away. So Station MD has a list of all of our waiver clients, and they'll know when that person calls, go ahead and provide the service, and then they'll send us a list on the back end at the end of the month or whatever timing we have worked out and say, as of this day or during this month, this is the list of clients that access services, and then the waiver authorization will be put in on the back end to go back to the day that the client chose that service. It's not like it can't work the regular way, so you could be having a conversation with the client and family at a planning meeting and say, did you know this is available? Do you want to add it to your care plan? It can happen that way still and go through the regular process, but we really want to just let families know, like, call anytime, clients know, call anytime, you can access it anytime. So we will make the memo actually read that way and send it through a review again so that it does make sense. Then the enhanced FMAP. So the rates that were supposed to go into effect on July 1st for residential and for a 5.29% increase for personal assistant services. That was waiting on CMS to approve the enhanced FMAP spend plan. They did approve that on Monday. Hallelujah. So that announcement went out from MoHealthNet Division in one of their provider email blasts. And then we are finalizing the memo on that. I think all the cat's out of the bag and all of the providers know because the phones, I think a phone tree blew up when we made the first phone calls to let folks know that had been approved and the rates would go back. So the way that it'll work, just you'll see the memo coming out, but if you get questions, as of October 1st, the rates are going to be at the new level. And then for July 1st through the end of September billings, if you are on here and you are a business office staff, you are deserving of an award right now because you all are going to, I know you're aware, going to be doing a lot of extra work on top of other duties as assigned to make sure that these providers are able to get the funding retroactively for those services that have already been billed for those months. So thank you in advance for all of the time that you're dedicating. And that process will take all hands on deck probably through the end of December, through the end of the year to get those provider billings caught up from July through September. More CMS news. I guess they had a week. The waiver renewals are here. They were approved. So it was July 1st was when they were supposed to be approved, but so the training for what were included in the changes and adjustments to the waivers will be coming to you soon, and FPU is working on that. That's enough CMS news. Soft phones. So if I know plenty of you have used soft phones and probably know how awesome they are. If not, it's a phone that lives inside of your computer and it works way better than you would think. And so the phones, the hardware phones that we have, a lot of them are going out of, I don't know, they're expiring, whatever you want to call it. And so they need to be replaced, and we made the decision to invest and not replace hardware phones unless someone has a reason to need one. So almost everyone will be getting a soft phone, which is amazing because it makes working in a distributed manner, remotely, going back and forth, so much easier. So very excited about that. Chronic disease, I'm going to run out of time. Okay, chronic disease self-management education. Just for your awareness, there's a partnership that is going to be, you don't need to do anything on the soft phones. The information will come to you through department admin, through Beth Hershkin, my assistant, and she'll tell everybody what they need to do to take care of stuff. I just found that out. And Amber Daughtry was like, what do we need to do? And I'm like, I will find that out. Good question. So I don't know if any of you are familiar with chronic disease self-management education courses, but they are a evidence-based course that deals with chronic conditions, so pain management, diabetes, how to self-manage and make sure that you are taking care of yourself in the right way to manage your condition is really the goal. And so there is a grant that we have been working on in partnership with Department of Health and Senior Services and the area agencies on aging for like 3 years to finally we applied for one with this really great idea in one of the original, like right before COVID releases of the grant opportunity for chronic disease self-management. And the federal government was like, it doesn't fit the grant parameters. But we think it's such a good idea that they put out a new grant and the parameters like basically described what we were trying to do. So it's always good when they like your grant application so much that even though they don't approve it, they write a new grant initiative based on that. So what we're going to be doing, and you'll hear more about it, is identifying clients who would benefit from receiving chronic disease self-management education. The courses will be free. They can bring their caregiver with them, and it'll be a 6-week education course. And then on the back end, we will pull data to hopefully show that that individual had good health outcomes from the course and the education, and then that puts us a step forward into being able to offer it to all of our clients through a value-based payment initiative, saying it's wise to invest in allowing people to learn how to manage their chronic conditions, and it works for people with developmental disabilities, and you should do it. We have the data. It saves you money. Organizational efficiency. So Heike is going to pull up her screen. This is something we talked about that we were going to do on maybe coffee chat number 1. But I'm a really big intranet to get your feedback kind of person. And so this is like part 1 of one of the things that we talked about. And so also don't forget there is a 10:30 open meeting for organizational efficiency updates today. Heike, do you want to pull up your screen? She's working on it. I'll talk. The intranet now has a organizational efficiency section. So really go out there, check it out. It is got all of the resources that would, in case you have stuff going on and can't go to every webinar and attend every meeting. It's got kind of all of the resources in one place where you can access, like, what is this unit doing, the webinar they gave, what's the overview, if I need to go back and kind of see the bigger picture of where we're at in things. It's got all of those resources on there for you to take a look at. Not necessarily something that we would want to put on the public internet, because this is really just for our team members. And then there is also a We Want Your Feedback link that walks you through some very specific questions. And I'm just going to go ahead and share my screen because I think, I just needed to say the words, Heike. Sorry. If you want to click on the feedback link, Heike, under the organizational efficiency, you can see the resources there below. The survey is anonymous, but we want your feedback on how things are going, because right now it's traveling up and filtering through, or only happening if you attend a certain meeting about a certain topic. So this gives us a way to get feedback in a way that is something that we can use and make sure that we have a clear understanding of across the division how the team thinks we can improve. So if you want to hit next on that. Just some real basic questions. Hey, what's working well? And tell us about it. And what parts of the organizational efficiency can be improved? So tell us what's working well, tell us what needs improvement, and then tell us how you would fix it. What's your proposed solution? And then just any additional information that you think would be helpful to share. And you can give your contact information. Maybe the additional information you want to share is that you want to be a part of implementing the solution or be a part of a further discussion about it. That would be great. Just stick that in there and hit submit real quick, and appreciate everyone ahead of time taking the time to do that. The other thing I wanted to mention about the intranet is that so the organizational efficiency is up there now, and coming soon is the next section that we talked about, which is the special projects and initiatives. And I'm really excited because there's already some initiatives going on that I think we need all of the great minds that are willing to participate from the division to come on in and help us with this. So a couple of things that just come to mind that is in the pipeline for the policy manual rewrite, which Amber's leading, and then so the special projects is more like a part of the intranet, and you can always give feedback about how we can make them, and you can close that that screen if you want, Heike, or keep it up if you want to go back to Kahoot here in just a second. But the special projects is really going to be, first of all, here's a list of the special projects and initiatives that are going on, and is there any that you have specific expertise in that you want to be a part of, that you can contribute to? What sort of contribution do you want to have? Do you want to just, be a part of a work group? Do you want to, do you have just a kind of specific feedback to give to start the project off? Any of those is little or as much involvement as you want, or is there something that you think we should be doing as a special project initiative to enhance things that are going on for clients, families, providers, and what is that? So one of the things also that you'll see up there is that we really want to tackle the transition planning for aging caregivers, and how can we make that just more of a successful, because we see other states doing things, and nobody has it quite figured out to the right specificity, because we still hear feedback from families saying, I'm not sure what I'm going to do if the day, because you can't predict the day that you're not going to be able to care for your adult child in your home anymore. Like, is that going to be when I fall and break a hip? Is that going to be when I am I going to know ahead of time? Am I going to start cancer treatments and know I'm going to be sick? Am I going to be hit by a bus? Like, I need to know what the plan is, and there needs to be a solid plan for what happens when I'm no longer there as an aging caregiver. So just taking some of the anxiety out around that planning process is something that I know a ton of you have really good expertise on because you've been working with families for so many years. So we're going to collaboratively take all of those good ideas and turn them into something that we can implement in a more formal way. By the way, I know we're talking about all the things we can do to improve, but just in the past week, I've been on like 3 calls, and I always say, I can't take credit, I've been here 5 months, but national, all around the nation, states and different national organizations are like, Missouri is really a model for care for individuals with IDD, and this part of what you do is just really such a model, and that's you guys. So you should be getting those kudos right now, and just know that there are a lot of people around the country who think what you're doing on a daily basis is something they've got to figure out how to do themselves. So that is awesome. We are 1 minute over, but I'm going to ask you for another Kahoot question. So give me a couple more minutes, pull up your Kahoot, and this question is to give us all good ideas on what we can do in our self-care time. What TV show, movie, book, or podcast have you seen, read, or heard recently that you would recommend for the rest of us? And we'll share these results so we can all have good ideas. I'll type mine in. See a couple in the chat too. Okay, good. Five, four. Oh, this is exciting because there are a ton of these that I have never heard of, which means I have a whole new list of things to fill up my time when I want to just zone out. Okay, hope this was helpful and you guys enjoyed it as much as I did, and that you have a great weekend. I will let you know and maybe get some video. Our oldest daughter, her Special Olympics softball game and tournament is tomorrow, and she's on the co-ed adult team, so for the first time. So my husband's coaching, so I'll have to let everybody know how that turns out. Everybody have a great weekend, enjoy the weather, and I will see you next time. See you soon.